Hi everybody, my name's Jade and I work on the Answer Cancer Programme.
And I'm Suzanne Cahill. I'm one of the Specialist Screening Practitioners and I work for Bowel Cancer Screening and I'm based at Bolton Royal.
So we've been putting together a series of Q&A videos just to answer some frequently asked questions around bowel cancer and bowel cancer screening. In our series, we've already addressed what bowel cancer is, what's involved in completing your FIT kit at home, and what happens next when you receive a positive FIT result. So what does happen next is that you will be invited to attend a colonoscopy, and quite often on the Answer Cancer Programme, people ask questions around, is the colonoscopy uncomfortable and does the colonoscopy hurt? So Suzanne's going to tell us a little bit more about that today, with the honest truth, aren't you, Suzanne?
I am.
So can you tell us, does the colonoscopy hurt, and do people experience some discomfort when they're taking part in that?
It is a very difficult question to answer because everybody is different and everybody's perception of pain or discomfort is different as well. It can be uncomfortable because the camera is about the thickness of your index finger. But what we do as well with the camera, we put air inside as well. So we're basically putting air inside a tube. And what the air does, it stretches this tube, so it stretches your bowel. And this is what causes the discomfort.
Oh, thank you. Is there anything then that can be done to make the test more comfortable for people that might be experiencing that discomfort?
There is, and it's important to mention that when you're having this test, you are the most important person in the room. And there are nurses that are there just to look after you and make sure you are comfortable and explain everything that's going on. But there's a few things that we can do. One of them is that we can offer a sedative injection and a pain relief injection. And you can actually have this before the test starts. And what that'll do, it won't knock you out completely. It just makes you feel a little bit more relaxed and a little bit sleepy. But you're still aware of everything that's going on. And one of the other things we do, you'll actually start the test lying on your left side. But during the test, we can ask you to lie on your right side or we can ask you to lie on your back. And what this does, it just changes the position that the bowel is lying in, and that can also make you feel more comfortable. And one of the other things is that the test will be done by a very experienced consultant, and they are very skilled and knowledgeable about what they're doing, and that actually does make a big difference as to how comfortable the test is or how well you can tolerate it.
Oh, definitely, thank you. It's important that people know that there are people in the room that really care about their well-being in that situation, isn't there?
Absolutely.
Oh, that's fab. Thank you so much, Suzanne. And can I just finish by asking Suzanne, is there anything else that you think could cause discomfort during a colonoscopy that maybe you've not touched on?
Yeah, some people can have piles, which are just like sort of varicose veins on your bottom that can sometimes bleed and feel quite sensitive. And people still need a colonoscopy, even if they think that's the reason for them having the blood in the poo. But what we can actually do about that is put some, like a local anaesthetic on the bottom, just to make them feel more comfortable.
Oh, good. That's fantastic. Thank you very much, Suzanne, for answering those difficult questions, because we all know that those are the hard ones. But thank you, and thank you to everybody listening. And please continue to tune in for the other questions we have for Suzanne in the upcoming videos.